Today we will take you through the Discovery Health options for 2014, as well as offer you some tips on how to go about choosing the correct plan to meet your specific needs. Before we look at the options available and provide you with tips on how best to select one of those options, it is important for us to highlight a couple of important facts regarding the Altron Medical Aid and Discovery Health amalgamation. We need to understand what the objectives were and from an Altron point of view. Altron Medical Aid lacked freedom of choice. You as the member had very limited plans to select from. The medical scheme environment in South Africa is complex and requires increased management and focus. Altron's core business is not the running of a medical scheme. So what does all this mean for us? Altron Medical Aid costs were escalating due to the profile of the medical aid getting older. The costs of claims being paid out far exceeded the contributions coming in. This meant that the medical aid had to use reserves to subsidize the contributions. Increases would have been in excess of inflation to keep up with the rising costs. Benefit reductions and limitations would have been put in place. The Board of Trustees were proposing an amalgamation with another medical scheme. It is due to these reasons and to protect the Altron employees that the process of amalgamating the Altron medical scheme began. So why was Discovery Health selected over all the other medical schemes? We once again highlight points raised by Alexander Forbes in the initial roadshow. Discovery Health is large with a stable risk pool and thus reduced claims and contribution volatility. This means that the risk of higher than inflation increases and benefit reductions are reduced. They have economies of scale which facilitate competitive negotiation power with regards to provider groups. There will be no underwriting or waiting period imposed on members during the transfer. Lower options are income rated to suit lower income earners. Without the merger, AMA would face a future of high and volatile contribution increases and more than likely further benefit reductions. Discovery Health offers a wide range of options to cater for everyone's individual affordability and healthcare need. The only disadvantage of a merger with Discovery is that the options are not an exact match to those of Altron Medical Aid. But you as a member have choice of more than 19 options to ensure the best fit for your needs. There may be some members that are disadvantaged slightly, but overall the future of AMA is not sustainable in its current form. Here are the terms and conditions from Discovery with regards to the amalgamation. The transfer of the AMA members will take place with effect from the 1st of January 2014. All the reserves within AMA will be transferred to Discovery on the effective transfer date. The AMA options have been mapped to the closest match on the Discovery Health options, and these will form the basis of the default option for all members, should they not make an option selection. It is important to note that you are not restricted to the default option, but you can select any of the Discovery plans. It is only if a selection is not made by yourself that the default plan will apply. Membership to Discovery Health is compulsory for all new staff members for 1 January 2014. This is with the exception of the employees under the collective bargaining agreement. Very important to note, the cutoff date to receive your option selections, or for those of you on Discovery Health already, your option change, is the 18th of November 2013. Should we not receive communication from you in this regard by the 18th of November 2013, you will automatically be placed on one of the default options. So where are we within the amalgamation process? All the steps within the process have been finalized, with the exception of the transfer of the membership, which will take place effective the 1st of January 2014. We will be looking at 4 sections in this presentation, and depending on the questions, it shouldn't take more than an hour. We will look at the 5 key decisions that you will face when selecting your option, and will explain each one. We will then look at the Discovery Health options available and offer an explanation of each. And lastly, we will touch on the vitality benefits and what they are. The main focus will be on your option choices, not vitality. When looking at selecting a plan for 2014, you need to ask yourself 5 key questions. These questions will assist in helping you select the correct plan for your specific needs. The first 3 questions are specific to hospitalization. Question 1. Could you be limited to a network of hospitals, or do you prefer freedom of choice? Question 2. Would you accept co-payments or annual limits? Question 3. What rate of hospital reimbursement is appropriate? Question 4 relates to the chronic benefit. Do you require additional chronic cover? Question 5 relates to day-to-day cover. To what extent do you require day-to-day cover? Once you have answered each question, you should be on target to make your plan selection for 2014. Now let's look at each question in more detail. When looking at hospitalization cover, medical schemes offer choice in terms of how hospitalization cover. You can select an option that covers you in any private hospital for both emergency and elective procedures. These type of plans usually have a higher premium per month, or you can select an option that works through a network of private hospitals for elective procedures. Because the medical scheme has negotiated a lower rate with these networks, you will pay a lower monthly contribution. Remember that all emergency events are covered in a private hospital with Discovery Health. It is also important to review the list of network hospitals to ensure that there is one near to your home or workplace before making a decision on the network options. You also need to ensure that if your specific specialist practices at these network hospitals, and also consider if you are prepared to change to a specialist that has a payment arrangement in place with Discovery. All these choices can reduce your out-of-pocket exposure. When we look at co-payments for hospitalization, it is important to note that some options have stipulated upfront co-payments or deductibles for planned in-hospital procedures. These options have a lower monthly contribution. Are these acceptable for you? Medical scheme options may differ in the rate at which they cover specialist providers in hospital. The higher the rate, the higher the contribution. 300% can be aligned to a private rate, while 100% is mostly acceptable as the medical scheme rate. Very important to remember, gap cover products can provide up to 500%. With effect from January 2014, Altron gap cover will be replaced with Zealous Gap. There is a slight price increase, but you will receive far greater benefits, which include co-payments and deductible cover, as well as sublimate and oncology benefit cover. There are also additional benefits as shown here. All members on Altron Gap will automatically be transferred to Zealous with effect from January 2014. All Altron employees have the opportunity to join Zealous free of underwriting from 1st of January 2014 to 30th of April 2014. When looking at the chronic cover per option, it is vital that you check the chronic conditions covered. All medical schemes must provide cover for 27 prescribed minimum benefit conditions. If your condition is not one of the 27, you may have to look at an option that covers additional conditions. You need to consider if the contribution increase to get the additional chronic cover is worth the contribution increase payable. All AMA members that had additional chronic conditions were defaulted to the classic comprehensive option. This does not mean that your additional chronic will be covered. A number of the additional chronic conditions covered on the enhanced option are not covered on the classic comprehensive chronic list. However, they will be covered from your prescribed medication list. The day-to-day benefit is there to cover all other medical expenses that occur outside of hospital and other than your chronic illness benefit. Do you have little or no day-to-day needs? You may need to look at a hospital or savings option known as Core or Saver series of Discovery. The Core series offers no day-to-day cover. Do you have small day-to-day needs? You may need to look at a savings option known as the Saver series. Do you have medium day-to-day needs? You may need to look at an option that has a limited threshold benefit, such as the Priority series of Discovery. Do you require extensive day-to-day cover? You may need to look at options that provide maximum savings and an unlimited threshold, such as the Comprehensive series of Discovery. So what to do now? Review your answers in each step, confirm a one-on-one session for a full needs analysis with your allocated consultant, and confirm your 2014 plan selection. As an Altron employee, it is important to remember that with effect from 1 January 2014, the Altron Medical Aid has amalgamated with Discovery Health Medical Scheme, and the Altron Medical Aid options will no longer be available. Should you not make a choice of one of the Discovery Health options before the 18th of November 2013, you will automatically be defaulted to the closest Discovery Health plan. We will look at these options in more detail. As discussed in the previous slide, the options that you see on the screen are now the default options for Altron Medical Aid. We have also shown you the alternatives in the same benefit and costing category that could be possible choices for you. This slide shows you the contributions per option versus the Altron plans. The Altron options are based on the 2013 rates plus 7% on basic and 8% on enhanced, while the balance are the new 2014 rates for Discovery. The slide shows you the annual medical savings account per option. Please note that although the contributions may be higher in some instances, the benefits for day-to-day are far higher than what you enjoyed on the Altron Medical Aid plans. We have purposely highlighted the priority series in red, as it is important to be mindful that these options have a limited above threshold benefit, and once this limit has been reached, you pay for the balance of your day-to-day cover. Therefore, you need to add your annual MSA plus above threshold for total value available for the day-to-day cover. This slide shows you the scope of the options available and the approximate costs for each. You can see that there is an option to suit everyone's affordability and healthcare need. In this slide, we show you the annual savings and threshold benefits, as well as the self-payment gaps applicable to each option. It is important for you to note some key considerations regarding this process. Your membership cards will be delivered to your HR contact. They will communicate with you once they are available for collection. We have an expected delivery date for early in December 2013. Please can you ensure that you update all your and your dependents' information with Discovery Health on the contact numbers listed above. This is to ensure that your cards can be printed accurately. Very important. On AMA, dependents were charged the child rate up until the age of 23. On Discovery Health, the child rate is applicable to age 21. For some of you, this may mean a slightly higher increase than expected. Please make sure that you are aware of the additional costs. If you have an existing waiting period or late joiner penalty applied to your current membership, the balance of these will be carried over to Discovery Health. If you are a member who is a diabetic on the Altron Enhanced option and you are registered with a CDE for the management of your condition, please take particular note of the fact that only options on Discovery that provide cover for CDE management package are the Executive and Classic Comprehensive options. All other plans provide chronic cover for diabetes, but not through the CDE. Please keep this in mind when making your option selection. It is important for you to note some key considerations regarding the option selection process. The cutoff date for option selection is the 18th of November. Late submissions cannot be guaranteed and could also generate double deductions and proration of benefits if left too late. Please ensure that your selection is made prior to the 18th of November. You by now should have received your login and password details either via email or SMS to access the electronic option selection form on the How Can We Protect You website. You can access the site to update your details and complete your selection. If you prefer to submit a hard copy option change form, this can be done by completing the form and submitting to your HR department. We will now have a look at Discovery Health in more detail. Discovery Health has a wide range of options to choose from. From the top of the range executive plan to the Key Care series, there is an option to suit everyone's affordability and healthcare need. The executive being the most expensive, to the Key Care series being the most affordable option. Let's look at the executive plan. This is Discovery's top of the range option and provides you with unlimited hospitalization cover in any private hospital for both planned and emergency events. The rate of cover on the executive plan is 300%. The chronic benefit includes the PMB conditions as well as an additional disease list. The day-to-day benefit has the maximum 25% savings account, no automatic self-payment gap, and an unlimited threshold. Should a self-payment gap be created due to claiming patterns, there is cover for certain benefit through the insured network benefit. A full explanation of the INB will be given in a later slide. It is important to note that associated accounts for in-hospital, such as anaesthetists, specialist radiology, etc., are paid from your medical savings account. The next plan series available is the Comprehensive series. Here you have a choice of plan within the series. The Classic Comprehensive Plan provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 200%. The chronic benefit includes the PMB conditions as well as an additional disease list. The day-to-day benefit has the maximum 25% savings account with a small automatic self-payment gap and an unlimited threshold. When in the self-payment gap, there is cover for certain benefits through the insured network benefit. A full explanation of the INB will be given in a later slide. The Classic Comprehensive is the default option for enhanced members with an additional disease list for chronic. The Essential Comprehensive Plan provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 100%. The chronic benefit includes the PMB conditions as well as an additional disease list. The day-to-day benefit has a maximum of 15% in savings with a larger automatic self-payment gap and an unlimited threshold. When in the self-payment gap, there is cover for certain benefit through the insured network benefit. A full explanation of the INB will be given in a later slide. Both the Classic and Essential Comprehensive plans have a Delta option variant. The Delta plans provide access to a network of private hospitals for elective procedures. Emergencies are still covered in any private hospital. These options have a lower monthly contribution. The Classic Comprehensive Zero MSA option provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 200%. The chronic benefit includes the PMB conditions as well as an additional disease list. The day-to-day benefit has no savings account but an unlimited threshold. There is no cover on this option for the insured network benefit. The next plan series available is the Priority series. You have a choice of plan within the series. The Classic Priority Plan provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 200%. The Priority series has a list of 13 planned procedures done in hospital that have an upfront co-payment. The chronic benefit provides cover for the PMB conditions. The day-to-day benefit has a maximum of 25% in savings with an automatic self-payment gap and a limited above threshold benefit. When in the self-payment gap, there is cover for certain benefits through the insured network benefit. A full explanation of the INB will be given in a later slide. This is the default option for employees on the enhanced option that have no additional disease list chronic conditions. The Essential Priority Plan provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 100%. The Priority series has a list of 13 planned procedures done in hospital that will have an upfront co-payment. The chronic benefit provides cover for the PMB conditions. The day-to-day benefit has the maximum of 15% in savings with a larger automatic self-payment gap and a limited threshold. When in the self-payment gap, there is cover for certain benefits through the insured network benefit. A full explanation of the INB will follow. The next plan series available is the Saver series. You have a choice of plan within the series. The Classic Saver plan provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 200%. The chronic benefit includes cover for the PMB conditions. The day-to-day benefit has a maximum of 25% in savings. There is no threshold benefit on this plan. Once savings have been depleted, there is access to certain additional benefits through the insured network benefit. A full explanation of the INB will follow. The Classic Saver is the default option for the basic members on AMA. The Essential Saver plan provides you with unlimited hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 100%. The chronic benefit includes cover for the PMB conditions. The day-to-day benefit has a 15% savings account. There is no threshold benefit on this plan. Once the savings have been depleted, there is access to certain additional benefits through the insured network benefit. Both the Classic and Essential Saver plans have a Delta option variant. The Delta plans provide access to a network of private hospitals for elective procedures. Emergencies are still covered in any private hospital. These options have a lower monthly contribution. The Coastal Saver option provides you with unlimited private hospitalization at any private hospital in the coastal regions for both planned and emergency events. The rate of cover is at 100%. The chronic benefit includes cover for the prescribed minimum benefit conditions, and the day-to-day benefit has the maximum of 25% in savings. There is no threshold benefit on this plan, and as well as there is no access to the insured network benefit on this option. The next plan series available is the Core series. You have a choice of plan within the series. The Classic Core plan provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover is at 200%. The chronic benefit includes cover for the P&B conditions. There is no day-to-day cover. The Essential Core plan provides you with unlimited private hospitalization at any private hospital for both planned and emergency events. The rate of cover here is at 100%. The chronic benefit includes cover for the P&B conditions. There is no day-to-day cover. Both the Classic and Essential Core plans have a Delta option variant. The Delta plans provide access to a network of private hospitals for elective procedures. Emergencies are still covered in any private hospital. These options have a lower monthly contribution. The Coastal Core option provides you with unlimited private hospitalization at any private hospital in the coastal regions for both planned and emergency events. The rate of cover is at 100%. The chronic benefit includes cover for the P&B conditions, and there is no day-to-day cover. The next plan series available is the Key Care series. You have a choice of plan within the series. The Key Care Plus plan provides you with unlimited private hospitalization within a network of private hospitals for both planned and emergency events. In the case of an emergency, you will be taken to the closest private hospital until stabilized, when you will be moved to a Key Care network facility. You have an unlimited chronic illness benefit for the P&B conditions. You need to obtain your medication from a network pharmacy. Day-to-day care is unlimited, providing you work within the network. You will have to go to your selected GP from a list of Key Care GPs. He is the only GP you can use. Providing you go to the selected provider, you will have unlimited visits. Basic dentistry, optometry, medication according to a formulary, basic x-rays and blood tests are unlimited, providing that you work within the network. There is a specified limit for specialist visits. The Key Care Access Plan provides you with unlimited private hospitalization within a network of private hospitals for maternity and emergency events only. In the case of a planned event, you will need to utilize a contracted state hospital. You have unlimited chronic illness benefit for the P&B conditions. You will need to obtain these from a network pharmacy. Day-to-day care is unlimited, providing that you work within the network. You will have to select your GP from a list of Key Care GPs. He is the only GP you can use. Providing you go to the selected provider, you will have unlimited visits. Basic dentistry, optometry, medication according to a formulary, basic x-rays, blood tests are unlimited, providing that you work within the network. There is a specified limit for specialist visits. The Key Care Core plan provides you with unlimited private hospitalization within a network of private hospitals for both planned and emergency events. In the case of an emergency, you will be taken to the closest private hospital until stabilized, when you will be moved to a Key Care network facility. You have an unlimited chronic illness benefit for the prescribed minimum benefit conditions. You need to obtain your medication from a network pharmacy. There is no day-to-day cover, but you do have access to antenatal services and specialist consultations via the network. The Key Care series is an income-based option, and income verification is required when joining this plan. It is important to note that when your salary increases, your contribution will also increase if you move to a new income band. This is over and above the annual increase which is related to the medical scheme. So you can see the scope of the options available and approximate costs. You can see that there is an option to suit everybody's affordability and healthcare need. Discovery Health have additional benefits: emergency assistance, Africa benefit for those members working in Africa, trauma support, international travel benefit, as well as liaison officers in hospital to ensure quality of care. The Insured Network benefit provides members with access to an additional benefit once savings have run out or you are in your self-payment gap. These benefits include GP consultations with a Discovery Network GP, pathology done via select providers, day-to-day generic medications, again at a select provider. The Insured Network benefit also covers maternity benefits and selected external medical items on certain options. Discovery also offers discounts and rewards through using preferred provider networks for certain benefits. These include Schedule 1 and 2 medications obtained through clicks via the MedSaver benefit, discounts on chronic care products through Dischem, 20% savings on frames and lenses via the optometry network, and 25% savings on stem cell cryogenics via NetCells. Vitality is the rewards program offered by Discovery Health. It is available at a monthly contribution to all members, regardless of what plan they are on. Vitality encourages you as the member to know your health, improve on the non-healthy areas, and enjoy the rewards of your efforts. Focused training sessions on Vitality will be held in early 2014. For these sessions are to ensure that members make the right choice to meet their medical scheme needs. There are over 40 different partners on Vitality that assist you with your overall health and wellness. These range from gym benefits through Virgin Active and Planet Fitness, Smoke Enders, Alan Carr, Wayless, to name a few. There are also leisure partners in discounted local and international flights, car rental, and hotel arrangements. You can also access discounts via Ster-Kinekor and a wide range of additional retail partners. There is also the Healthy Foods benefit, which is available to all members on Vitality. You can receive up to 25% cashback on healthy foods purchased at Woolworths and Pick n Pay. You will need to complete your health risk assessment and register online for this benefit. We thank you for your time today.